Dr. Kevin here from Lake State Chiropractic, and today I want to talk about spinal degeneration. So, we know that spinal disability is the leading cause of immobility in people over the age of 60 years old. But I have an interesting study that I've been looking at that shows how this is starting when we're much younger. So, this study covers 3,110 individuals who are all asymptomatic, so they don't have pain in their lower back. And this study found disc degeneration in 37% of individuals by the age of just 20 years old. These 20-year-olds also had a disc bulge in 30% of individuals tested. And these are all asymptomatic people that are not experiencing any pain. Now, they did it every 10 years, but let's just look at 20-year-olds, 50-year-olds, and 80-year-olds. So, for 50-year-olds, disc degeneration was present in 80% of individuals, and disc bulge was present in a whopping 60% of individuals. And then at 80 years old, this one's probably a little less surprising, but disc degeneration was present in 96% of individuals, and the disc bulge was present in 84%. So that's crazy. By the age of really just 40 years old, based off this study, disc degeneration and disc bulges is prevalent in over half of the population, even if it's not causing symptoms. And this is why we need to start taking care of our spines when we're young, because these issues, once they start to form and we let them form, they're much harder to correct. Now I have a spinal model here that's going to help me explain why it is that we need to take care of these things before they become problems, because they are very hard to correct once they become a bigger issue that is causing pain. So let's start off with our healthy vertebra here. So we have our vertebral body up front here, spinous process back here, and then this right here, this is, get it so that you can see it. This is our facet joint right here. Okay, and now this is the disc itself. So this right here is called the nucleus pulposus, and it is jelly-like. So if this were a real spine, this would be very movable and almost like a thick fluid. And this is the annulus fibrosus, which holds that thick jelly into place. Now, none of this has a blood supply of its own. It is the vertebra above and below that gives it its blood supply. So when this starts to degenerate, it causes a small disc bulge to form. Now, in 8 to 12 weeks, on average, these disc bulges will reabsorb and remain asymptomatic as long as the stressor that's causing them to herniate goes away. If that stressor is not corrected, it will continue to cause pressure, and these channels will keep forming, and it can herniate. When the disc bulge actually herniates, it can put pressure on the spinal cord here or the nerve root here, and this is when a lot of patients are going to need surgery or further issues because they have radiating pain into their leg, causing them intense pain. A disc bulge right on the spine can cause patients to have trouble using the bathroom and cause all kinds of serious issues. And this is preventable by keeping the spine moving properly. While we're at it, let's just talk about our final model here before we move on. So this spine does not show any disc herniations, although somebody with this serious of condition would most likely have one. So this is just spinal compression that's causing bones to form osteophytes, and it is causing increased disc height. Now I want to say, we all experience increased disc height every single day. As I was saying, the disc is not very well vascularized. It gets its nutrients from the vertebral body above and below it. So as the day wears on and we continually put pressure on that disc, it starts to become thinner. And that's why we have to sleep in good position to help our body regenerate that disc every night, which is a big reason why people who sleep in recliners or people who sleep on their stomachs and they never really give their spine the optimal position to regenerate that disc height tend to have more problems. Okay, now how is this happening and how can chiropractic help? I'm going to pull out my full spine here, and let's talk a little bit about a healthy curve versus an unhealthy curve. So when you have a healthy curve in your lower back, when you run, walk, jump, move, do whatever you do, it's going to flex like so, and the muscles and ligaments attached to the spine here will be able to handle a lot of that force and a lot of that abuse. Now the muscles are very well vascularized and can heal quickly and can handle that load. Now, if our spine is too curved, that puts the pressure on the back of the spine. So that's going to put the pressure on this facet joint here that we were talking about earlier. And when it repeatedly happens, all the cartilage or padding in that joint is start to wear away, and now you have a facet syndrome, and that facet is going to become damaged and painful. Now let's reduce the cervical curve, and we see this a ton in the lower neck as more and more people are looking down at their phones. Their lower neck gets straightened out. And when you run, move, walk, jump, do whatever you do, all that force is put on the disc. And that is what causes that disc height to drastically decrease and not be able to recover simply by going to sleep and rehydrating the disc. So this is why it's so important to keep your spine lined up so that that force can be properly managed, so that the muscles are handling that force of your daily activities instead of either the disc or the facet joint. And as this study is showing, it is important for people of all ages so that they can keep mobile through their entire life, so that they can enjoy the hobbies that they want to do. They can continue to play sports. They can play with their kids, their grandkids, and just make life worth living. So please take care of your spine. And if you have any questions, don't hesitate to stop by or give us our office a phone call. Thank you for watching.